Hey guys, welcome back to our channel Metphonics Talks. My name is Mohammed Anis and I'm a student from Fergana Medical Institute of Public Health, Uzbekistan. So it's been so much days or 2 or 3 weeks we have been add any videos to our channel because I was having some university exams. So now I am free. So I am continue with our previous lectures. Now I'm going to start about the question bank which is regarding the joints. Okay, so this question bank I have taken from the BD Chaurasia general anatomy textbook and also from some of the online sources. So it's around I'm having 20 to 20, yeah, it's around 23 questions. Okay, and these questions are just basics. There is nothing too much just over these questions. Okay. So the first question here, you can see that which of the following joint contains an intra-articular disc. Intra-articular. What do you mean by intra-articular? Intra-articular. Intra means inside. Okay. And articular means a joint. So, which among the following contains an intra-articular? Something in between the articulatory surface disc. Okay. Between the joint, there is a presence of disc. So, first one is ankle joint. Ankle joint is there is not having any disc there. And elbow joint. Elbow joint is also having no disc there. Sternoclavicular joint. They are flat surface and the joint part is flat. So, they are having the disc. Okay. Option C. Sternoclavicular joint is having disc. Okay. Next question. Which statement, and before that question you should always read 2 or 3 times about the statement questions. Okay, in this question also it's given that which statement about articular cartilage is correct. So they have given that maybe the question will be like which among the following is incorrect, which may some questions maybe we have to read and mark the correct one. So you have to think twice before you are answering. This question is asking which statement about articular cartilage is correct. First one, it is devoid of perichondrium. What do you mean by devoid? Devoid, devoid means that less or absent, okay, or free form, which means that they are lacking. Okay, devoid means that they are lacking. So, articular cartilage means that they are lacking perichondrium. They are lacking nerves. No, it's not right because it's they are lacking. They are not having nerves. It's a wrong statement. They are having nerves. Okay, and they are covered by synovial membrane. No, it contains lot of capillaries. No, they are not having any capillaries. So the answer first one, A, is the right answer. It is a devoid of perichondrium, which means that they lack perichondrium. Okay. Then third question, synovial membrane lines or encloses all structures except this synovial membrane. These questions, these topics I haven't discussed in our lecture videos because it's very time consuming, and I will take you when I am going to talk about the osteology of every bones. So now we have to study the fundamentals. So I am asking you with the help of the questions. Okay. So synovial membrane lines or encloses all structures except. So some of the given options, this synovial membrane is enclosing except something here. So first one is articular cartilage, second one is in inner aspect of capsule, then intracapsular tendons and intracapsular parts of articulating bones. So answer is A, synovial membrane lines every parts which is capsule, tendon and the articulating bone except the cartilage. Except the articular cartilage, the synovial membrane lines all the structures. Okay. Then Fourth question, all statement about synovial membrane are correct except. So they have given that except. You have to find the exception from this question. Okay, they have given four questions here, options here. Modification of deep fascia, it is avascular, it secretes synovial fluid. If damaged, it will regenerate. The option will be it is avascular. Okay, it will be avascular. Avascular means that they are not having any blood vessels. They are not having any blood vessel, which means that they are absent and they will be having no blood vessels there. So next question they have given that which of the following is a hinge joint. So in our lecture I have already taught you about this hinge joint, right? Hinge joint, it's like giving a flexion and extension movement, and you already know that the hinge joint is an elbow joint. I have given the example in that lecture video, so without confusion you can mark the option D, which is elbow joint, and it is example for the hinge joint. Then next question which of the following is not. Okay, I have told you to read once question again because they have asked about the not. Which among the following is a not a ball and socket joint? And option one, and I will teach you something. Here you can see that incudostapedial, right? Incudostapedial and incudomalleolar. Incudomalleolar. And this incudomalleolar, incudostapedial, this all means that these joints are seen inside our ear, which means that incus, malleus, stapes. So these joints are called as incudomalleolar, incudostapedial, these answers. Okay. So now we can go to the question, which of the following is not a ball and socket joint? You know that shoulder joint is a ball and socket, right? It is giving 180-degree movement, and I can flawlessly I can move my arms, right? Then talocalcaneonavicular joint is also found in the foot. When we are discussing about the foot joints and foot, I will tell you about the answer of the we will talk about that joints more about there. Then incudomalleolar. You know, incudomalleolar is not a type of ball and socket joint. Okay, incudomalleolar is not a type of ball and socket joint. Then next question. Before I am asking you about this question, I have to tell you something that we know that there is a nerve supply in our body, right? So if suppose one nerve is supplying to a particular muscle, which means that this muscle will be above some skeletal structure, right? So if some of the nerve is supplying to the muscle, means that it will also supply to the joint or whatever structures is below that muscle, it will all get the nerve supply together. Okay. Then the question, definition of the Hilton's law. First one, nerve supply a muscle also supplies the overlying skin and overlying joint. Okay. The next option is muscle around the joint act on the same joint. No. The capsule is rich in nerve fibers. No. The synovial membrane is rich in capillaries. No. The Hilton's law is explaining about the muscle and the nerve supply. Okay. So the answer will be the first one. The nerve supplying in a muscle also supplies the overlying skin. Overlying skin means that the muscle which is the skin which is associated with the muscles. So next one, the articular surfaces of articulating bones in synovial joints are covered by. So articular surfaces of articulating bones. So these articulating bones are covered by, or surface is covered by articular cartilage, joint capsule, synovial membrane, periosteum. So the articular surface of articulating bones. When this you know that the synovial joint is having synovial fluid inside them, right? And they are having some membranes which is covering to the proximal and distal part of the bones. So the articular surface of articular bone, these bones or these structures are covered by some articular surface. Okay, so some of the articular surface is covering among them, which is the proximal and the distal bone. And here will be the presence of, if I am going to draw in another color, here will be the synovial fluid. And if I'm going to take one another color, suppose it's blue, and this articular surface will be covering over the proximal and the distal part of these bones to reduce the friction. Okay, so the answer will be articulating or articular cartilage. Then next one, condylar joint. Simply condylar joints are biaxial joint, and this biaxial joints are very important because these joints will be showing their movement in the two planes. Okay, they will be showing in a two planes, not only one plane, it will show on the two planes. That is condylar joint. So the biaxial is the answer for the condylar joint. So moving on to the next question, which is the 10th one. Which of the following is not a saddle joint? Okay, again listen to the question well. Which is not a saddle joint? Not. First one, sternoclavicular. Then next one, wrist joint. Third one, first metacarpal joint, and the temporomandibular joint. So you know that the saddle joint is found in certain structures, right? In the wrist joint, it is not saddle. Am I right? Have you seen any saddle movement in my wrist? So option B, wrist joint is not a saddle joint. Okay. Next one, which is not a fibrous joint. You know that fibrous joint are synarthrosis, right? Fibrous joint are synarthrosis. Synarthrosis means that they are completely immovable or they are fixed to each other, right? So you know that these are found usually in the skull, in between the sutures. You know that coronal suture, sagittal suture, and there are many squamous suture, many other sutures, and these sutures are having fibrous joint. And gomphosis, I have already told you that gomphosis is a fixed joint, and they are found in between the teeth, which will hold the teeth with the gum with the help of periodontal ligament. Okay, this ligament is immovable and they are fixed to each other. Then Steffi sternal. You know that Steffi sternal is not a fibrous joint. Steffi sternal is a Syphilis sternal. What is syphilis sternal? You know that if it is a sternum, suppose this is sternum, and here you can see the mandibular structure, and you can see dagger shaped, and here is a xiphoid process. So in between this xiphoid process and the syphilis sternum, xiphoid process and the sternum body, this is the sternal body, and this is the xiphoid process. Here is the presence of syphi sternum. So the joint between the sternal body and the xiphoid process is type of primary cartilaginous joint. Okay, primary cartilaginous joint. Then so the second one, option C, syphilis sternum, is not a type of fibrous joint, but other three sutures, gomphosis, and the inferior tibiofibular joint, we will discuss about that in lower limb. Okay, then the next one, following all are the features of manubriosternal joint except, and they are asking about the exceptional cases. Okay, let's discuss all the options here. Then it is a kind of secondary cartilaginous joint. Yes, it's right. It's a kind of secondary cartilaginous joint. Then it is a symphysis type of joint. Yes, it's type of a symphysis joint. Symphysis means that they are fixed by the cartilage. Then it shows synovial cavity in 30% of cases. I already told that it is a kind of secondary cartilaginous joint, and I have already told that it is a type of symphysis joint. Then why there is an option need about this synovial cavity? Yes, you are right. It is right. This is the right answer for this question. But if we're discussing about the question, this is a wrong statement. Okay. Fourth one, it moves slightly during respiration. Yes, it will be moving to anterior posture. When you are taking the breath, this will move. Okay. Then the 13th question. Which of the following is a primary cartilaginous joint? Primary cartilaginous joint. It's very easy. First, sternocondral. Okay, we have already discussed in the past. It is the answer. The first one will be the answer, sternocostal. The first one, sternocondral joint. Then, next one. Synostosis is defined as union of bones. Synostosis, and this is a textual word. It is a textual defined definition. Synostosis is a union of bone to bone. Okay, bone to bone. Okay, it will be connecting the bone to bone. That is synostosis. So the option will be B, which is also the answer of this question. Synostosis is defined as a union of the bones by bones. Then name the joint present between the epiphysis and diaphysis. I will explain you again about the epiphysis and diaphysis now. If suppose this is a epiphysis, this is a bone. Suppose this is a bone. Okay, you can see that here the black portion. Okay, the black portion is the epiphysis. Epiphysis. What do you mean by epi? It means the end. Okay, and the middle portion is known as the diaphysis, and this diaphysis you are calling as a shaft of the bone. Okay, and this epiphysis you are calling as these epiphyses are the proximal and the distal end of the bone. So here there is in between the distal and the diaphysis there is a presence of some of the epiphyseal plate, okay, metaphyseal plate, and from here the bone will get elongated from the diaphysis of the body. So they are asking that which of the type which is the type of the joint which is present between the diaphysis and the epiphysis, which is the proximal and the distal end and between the shaft of the body. First option is a fibrous, second one is primary cartilaginous, third one is a secondary cartilaginous, fourth one is a synovial. So you know that it will be never be the fibrous, because if it is a fibrous then it will not move. Okay, then next one is a primary cartilaginous. Yes, it is primary cartilaginous because they are helping for the elongation or the movement or the growth of the bone. Okay, so it is the primary cartilaginous joint. Then 16th one, first sternochondral joint. Sternochondral joint. What do you mean by sternochondral joint? Chondral means cartilage. Sternum means sternum, right? So, which is the first joint which is forming between the cartilage and the sternum? First one is synchondrosis, second one is syndesmosis, third one is symphysis. Option D, none of the above. So, you can see here that syndesmosis will be not a right answer, right? Syndesmosis is seen between the two bonds, which is parallel to each other, and they are binding each other, right? And they are holding these two bonds. Like radial ulna is having interosseous membrane, tibia fibula is having interosseous membrane. These joints are called as syndesmosis. Symphysis, it's a fibrocartilage, right? It is not a fibrocartilage. Then the option will be definitely A, synchondrosis. Synchondrosis is slightly movable with the help of cartilage. Then next one. Which of the following joints is an example of synarthrosis? Synarthrosis means, what do you mean by synarthrosis? It is completely immovable. Very easy. Sutures joint of the skull. Okay, suture joint of the skull is the answer. Then next one, with regards to types of synovial joint, which of the following statement is true? A hinge joint permits movement in two planes, flexion and extension. With regards, read again the question. With regards to type of synovial joint, which of the following statements is true? They are asking about the true statement here. The hinge joint permits movement in two planes, flexion and extension. Two planes. No, it's not right answer. The wrist joint is a ball and socket type of joint, and never, it will be never. Then in a plane joint, the articular surface slide over one another. Yes, it will slide over, right? Then C will be the answer. In a plane joint, the articular surfaces slide over one another. Okay, slide over one another. The next question. 19th one. Which of the following describes a joint with the bones held together by interosseous membrane? I have already told you about that. Syndesmosis, right? Syndesmosis. Suppose this is a tibia. Suppose this is a this is suppose tibia, and this is suppose fibula. Okay, and they will be having some of the structures binding them each other, that is known as interosseous membrane, right? They will be binding and holding this tibia and fibula equally. So moving on to the next question, which of the following features is specific to synovial joint and not fibrous or cartilaginous joint? So it is, they are specifically asking about the synovial joint, not in the fibrous and cartilaginous joint. Movement can occur, yes. Contains hyaline cartilage, yes. Two bonds fused together, yes. Lubricated by fluid, yes. They are lubricated by fluid. They are having synovial fluid. Okay, they are having synovial fluid. Synovial fluid in between the articulating surfaces. Question 21. Ligaments are formed from which type of connective tissue? This is a question straight away from histology. Okay. So the answer, the question I will read you once again. The ligaments. Which type of connective tissue is found in the ligament? Ligaments are having dense regular connective tissue. Okay, dense regular connective tissue. This is straight away question. Okay, then next one. Which structure of a synovial joint is responsible for secreting synovial fluid? So we are having synovial fluid, and you know that what is synovial joint right now, right? So who is responsible for creating, or who is trying to secrete the synovial fluid? Okay, first option, outer fibrous layer, capsular ligament, inner synovial layer, hyaline cartilage. Okay, definitely it will be inner synovial layer, and the inner synovial layer is creating or secreting the synovial fluid to the surface of synovial cavity. Okay, next one, which is the last one. Which of the following does not contribute to the joint stability? Joint stability is a type of studies in joints, and this will be like a higher level, but it's okay to study by yourself right now. Which of the following does not contribute to joint stability? Which is not contributing to joint stability? The joint stability means that they are stabilizing the joint to fixed in one place, or they are fixating the joints there. Okay. First option, tone of surrounding muscles. Second one, accessory ligament. Third one, articulatory surfaces, and the bursae. Here, the bursae will be the answer. You know why? The bursae are not contribute to the joint stability. They are like a ligaments. They are bounding these surfaces, or some of the structures together. Like you can see in your cervical vertebra, in between the axis and atlas, there is a presence of bursae, which will they are connecting or bounding these inner surfaces, or everything inside this bursae. They are holding it together. It doesn't mean that they are increasing or they are contributing the joint stability. Okay, so the option D, bursae, is the answer. So these all were the questions I have been trying to make you, and trying to teach you more about these topics, because joints are very confusing to study, especially when you are studying osteology later. You will find to think or memorize the joints very hard, because joints are different types of classes. As we have told in last lecture, it will be more, and it will be more confusing, because a small type of joints, even between the vertebrae also there are types of joint, and even in inner ear also having different types of joints. So it will be so little bit confused, but it's okay to study like this. If you are having any mistakes in your questions also, or if you are answering any wrong answer also, it's quite natural, because anatomy is a type of subject which will be very hard for you, and not only for you, even I am also struggling to learn anatomy. So this is all for today. Next video I will be having the same question bank, which is according to the nail unit. Okay, so till this we have a long gap, but it's okay. We will and not only me and my colleagues who are trying to take it this video, everyone will try together, and we will reach out to you soon. So stay tuned, and I am requesting you to watch every video, because it will be study, and it will be very useful for your anatomy study also. Thank you.